Morning, Dr. John.
Hello.
I've heard you do mole removal without any scarring. How is this possible?
Well, actually, we have recently started doing some mole removal for all the clients, men or women, who are concerned about the moles which they don't like. They had it since birth maybe, and they don't like it on their face or maybe in the exposed part of the body, maybe arms, things like that. And we do this procedure by a very new technique called radiosurgery, or it's also called radiofrequency surgery, to be precise. And the results are rewarding.
That's good, that's good. That's amazing that it has no scarring.
Yes, that's absolutely.
Good. And is it a popular treatment in the UK?
Well, as I said, the treatment has recently started, so it is not everybody is aware of this sort of treatment. But yes, it gives a very good cosmetic acceptable scar. There is a scar, but scars are not bad like what we do classical surgery or conventional surgery, where the tissue had to be cut with a knife and they will make a scar, linear scar or a straight scar with scars of the stitches as well. Benefit of radiosurgery is that it cuts the tissue and coagulates the blood vessels at the same time, hence no bleeding occur during the procedure.
That's very good. And how is the procedure carried out?
With the procedure carried out after selection of the patient, we have to select the patient who is suitable for the procedure or who is not suitable for the procedure. Say for example, somebody has got a pacemaker for their heart. These clients are not suitable, and hence they can't have a radiosurgery or a radiofrequency surgery, or they have a heart valve, which is metal valve. Again, they are not suitable. Other than that, most of the clients are suitable, regardless of their age or sex, and they can have this surgery done under local anesthetic. We generally use local anesthetic, which entails a small injection at the area of the procedure, and following this, the area is numb, and then we remove the moles or the lesions.
So you can't really feel anything during the procedure?
No, you generally don't feel any pain during the procedure because the area is made numb with the local anesthetic lidocaine we use normally.
And can it be used on any area of the body?
Oh yes, it can be used any part of the body. As I said earlier in the talk, that you can remove it from the limbs or face, and it's a bloodless operation, and results are rewarding.
That's good. Do you need dressing on the wound after surgery?
Well, as I said, that the wound does not bleed, although a fresh wound is created, but there is no bleeding from the wound. Hence, we don't need to cover it. But if it is a large size defect, large size wound created after the operation, then yes, we would like to cover the wound, especially if it is on the limbs. But generally speaking, face wounds we don't generally cover, and after the procedure, many times client even say that it does not look that there was any operation done.
That's amazing.
Yes,
very
yes.
good. And how long does it generally take to heal?
Well, if the procedure is done on the face, and as we know from the scientific or medical background, the face has got a very good blood flow, very good blood supply, and as a result of good blood supply or good flow, the wound heals fantastic. They heal very well, and you get a very good results as well on the face, as opposed to on the limbs, because the limbs are poorly fed by the blood vessels, especially the skin, and hence healing is slower. Healing is it takes a little longer time, but generally speaking, on the face takes about 7 days, and by the end of 7 days, one will have a scab, a dry cover, natural dressing, what you call. And the scab will fall off in about say 2 weeks time or 3 weeks time, leaving a raw healed surface.
Are there any complications during or after the procedure?
Well, during the procedure, touch wood, I haven't come across, but if they have got things like metal implants in their body. That can be a complication, but we have to rigorously select our patient, the right client who is suitable for the procedure. But during the procedure, I do not think personally there is any complication. But after the procedure, as with any other operation, wound infection is the commonest one, or little bruising come on later on around the area of operation. That is a possible. So wound infection, delayed wound healing, scarring, these are the possibilities. But in my practice, we have done quite a few lately. I haven't seen one.
Sounds very good. Can you show me any before and after pictures of your work that you've done?
Oh really? Why not? Yes. Let's go to our website. This is our website. And I will actually ask you a question. This lady, she is about 35, and she was quite concerned about a mole on her face. I have removed a mole from her face. I would like you to identify any visible scar on her face. Can you try looking at the picture? Although this picture is quite close up.
Just there.
Well, that mark is what we call telangiectasia, or a broken thread vein. But other than that, can you see any scar?
Perhaps down here. This line.
I would say that I would say that line is a normal nasolabial fold line, which you get by the side of your nose and the mouth. With the aging process, with the volume loss, you do get a deepening of the line. But that is not a scar. Anything else you can see?
Nothing, no.
Okay. Well, looking at this picture, obviously the results is absolutely perfect. I'll show you her previous picture, how she looked before.
Oh my gosh. Yes.
So she had a large vein there, sorry, large mole there, and she had also another mole on the chin, and we agreed that we will remove this one first and we'll see the results. And the following picture that you see here is taken 1 month after the procedure. So it has healed very well here and no visible scar.
Yeah, there's nothing
Do you
there
agree?
at all. It's very, very good.
Yeah.
Do you have any more pictures you can show me of your
Oh
work?
yes. I'll show you a picture. This is the same lady in different profile. The same lady on the picture. This gentleman is a young fit man in his 30s, and he was quite concerned about this large mole on his nose, and we removed it, and this is the result.
That's very good. Very good.
Thank you.